I'm Jennifer Yeomans. I'm Deputy Head of Procurement at NHS Grampian, and just really going to give you a brief overview about NHS Grampian, what we buy, where we buy it from, and how we advertise our contracting opportunities. Just a brief overview about us, so to give you some background. We are one of NHS Scotland's 14 territorial health boards, and we cover the region of Grampian. There's a further 7 special national boards in Scotland, and they're boards such as the Scottish Ambulance Service and National Services Scotland, and they all also buy goods and services, either individually or collectively, and I'll talk a wee bit more about that as well. We're an employer of 14,000 people across the Grampian area, and this is across 3 health and social care partnerships. We cover the council areas of Aberdeen City, Aberdeenshire and Moray. We're a teaching centre in the north of Scotland, so we provide a broad range of specialist healthcare services. We have really strong links with our university partners and who are there training our health professionals and research innovation. We are also a major trauma centre, that's in ARI, which is Aberdeen Royal Infirmary, and we also have another acute hospital, it's Dr Gray's in Elgin. As a major trauma centre, we're part of a national network, so we're providing care for those in accidents and incidents and then transporting them to other areas. We've also got highly specialist services on our site as well, such as the National Hyperbaric Centre. We cover a region of 3,000 square miles, and obviously you'll know the area. It's a real diverse area and huge population, huge number of people. And so last year, NHS Grampian had a trade spend of just under 300 million. So that was in financial year 22-23. So that gives you a bit of background about us, and we, like I've said, provide a wide range of services across a huge geographical population spread. So that means that we are buying a wide range of goods and services for all areas of our organisation. So this slide just gives you an overview of the management team that you can get in contact if you'd like to. You might have met some of these people today at the event. Peter, Lisa, Steve, myself, we've all been here today on the stand, and we'll be here till the end. We have a contract development team who are engaged in putting in place contracts for the goods and services, and that's usually done via tendering. Where national contracts and frameworks are used, these are usually put in place by National Procurement, which is part of National Services Scotland. We also use Scottish Procurement and Crown Commercial Services. We've got an operational procurement team, and they're covering a wide remit, but including implementation of national contracts. So I'll cover the categorisation of contracts and the spend and what we buy in a moment. But when a new national contract has been in place, part of a key role of the team is to work with clinical services and all other services to implement those contracts and understand really a critical review of the data, what's available under those contracts and how we'll implement them. So within this team, there's also purchasing systems, and then we also have a team of people working across Grampian, which is ward product management. So they're procurement people within wards who are ensuring that we've got all the products that are needed at frontline services for our healthcare. All the health boards are supplied by NHS Scotland National Distribution Centre. So they operate central warehouses, and they supply all of the health boards across Scotland. They also do a lot of our procurement on our behalf, and those goods and services come in directly from the NDC, as we call it, into the ARI campus on a daily basis. And you'll see from this slide, a key part of that is we have a number of devolved procurement areas within Grampian. So these are areas that have responsibility for their own procurement, and they cover a number of key areas such as pharmacy, capital projects, it's listed up there. But we all continue to work closely, and we all follow the same internal governance. So this slide is a breakdown of our spend for financial year 22-23. So it really is a general overview of general categories of spend that we have within Grampian. This information is taken from the Scottish Procurement Information Hub. We're really fortunate in Scotland to have access to this system across the public sector, and it holds and categorises all our spend data. So I've also included there a category. I've said previously that we use collaborative contracts, which are put in place for us by a range of public sector procurement bodies, and within public sector procurements, we classify these within categories. NHS Grampian use national contracts wherever possible, accounting for around 50% of health board spend. And where national contracts don't exist, the contracting takes place at board level, so anything in excess of £50,000 is advertised on Public Contracts Scotland, and we're always following the board's standing financial instructions, so that determines the procurement route that needs to be followed. So Category A contracts that you'll see up here are contracts that are put in place by Scottish Government for use by all public sector bodies in Scotland. And they're for products really that everybody uses, so we all use stationery, IT hardware, for example. Category B contracts are put in place by National Procurement, which is the National Procurement Service for Health. And collectively, they manage over £1.4 billion worth of national contracts for health in Scotland. And these will be the contracts that we use most for a large majority of our clinical products, also facilities and estates, for example. And then we have local contracts, which are up here as C. So these are generally put in place by NHS Grampian staff. So that might be through procurement, or it might be also through our devolved areas, like I said, through estates or capital projects, medical equipment, for example. We always use the national procurement systems to advertise our contracting opportunities. So that's through Public Contracts Scotland, PCS. And I'm sure you'll have heard over the course of the day from a number of people the importance of registering your business or organisation on that system to access any opportunities. The opportunities on there will not just be from NHS Grampian, but from all public sector bodies and from all other health boards. For any contract opportunities that are under £50,000, we would look to use national frameworks wherever possible. So if this route's not available, we would then usually use Public Contracts Scotland to issue a quick quote to the suppliers through PCS. So we do have a desire to look beyond traditional procurement metrics into wider societal benefits of procurement spend, and we work closely with the public health team in NHS Grampian to understand how our spending and contracting activity can link with public health and the health improvement agenda. But we do have legislative drivers, so we all have to adhere to the Public Reform Scotland Act, and that ensures that public bodies have general duties around sustainability, supported businesses, and specific duties around community benefits, and these are included within our tendered contracts. We utilise the NHS Scotland Community Benefits Gateway, which was developed by National Procurement and Public Health Scotland to connect suppliers, and looks to directly improve the economic, social and environmental benefits of within an area through national and local contracts. Last year we became a living wage accredited employer, so we work with our suppliers to encourage payment of the living wage through contracts. We know how much we spend, and we have market intelligence around that, but we do have much to learn from our SME base and supported businesses. So we're really keen to widen the conversation and understanding, and that's been really key today to speak to a number of you, and we do encourage you to get in touch. So following on from that, last year we spent around £17 million within the Grampian area, and then a further £20 million with businesses across the rest of Scotland. We capture and categorise data through the National Procurement Data Hub, as I said. So that data is pulled together using the invoice address that's on our payment system. So it may not be exactly reflective of the amount of work that's actually happening within the Grampian area. They don't take into account any spend with suppliers who may have a large presence in the area but employ many local staff but who have an invoice address, for example, outside the region. I've put up the logo here for Plan for the Future. It's NHS Grampian's strategy for 22 to 28, and is a fully digital plan that can be accessed from our website. So as part of the Plan for the Future, NHS Grampian have identified that as a well-established and local organisation, often referred to as an anchor, NHS Grampian can influence economic, social and environmental responsibility and sustainability. And this can bring health benefits resulting from our purchasing and procurement decisions. And therefore, we've identified that we wish to increase the value of goods and services which are purchased from suppliers within the local area. However, we are aware that there's competing tensions around this. We already said that we buy many of our products through national contracts and have looked to aggregate spend to deliver cost reduction and also process and sustainability benefits. NHS Scotland's procurement strategy over the last 15 years has looked to increase national procurement contract coverage, which now sits at around 50%. We've looked to aggregate spend across Scotland to increase cost reduction, and we've centralised a lot of the hospital logistics through the National Distribution Centre. So this is also increasing to the difficulties around breaking that down now into local supply where possible. So even when tendering on our own, as NHS Grampian, we're a big organisation and we have a significant volume requirement given our size and contracting opportunities. So there can be significant in size and value. And we do aim to ensure that our contracts are broken into lots where possible and work with our main contractors to ensure that there are subcontracting opportunities through both our national and local contracting opportunities. We operate in a regulated environment. Any procurements over £50,000 are governed by the external regulations, the Procurement Regulations Scotland Act and Public Contracts Scotland Act, and these regulations require us to be open, transparent and non-discriminatory to award contracts by tendering, so we're looking to do that wherever possible. And we're actively engaged in the national conversations to implement government policy ambitions around community wealth building and public health. We do have a desire to encourage SMEs and supported businesses and to make accessing our contracts as straightforward as possible against the backdrop of these competing tensions. So that's the end of a whistle-stop tour of NHS Grampian. I've been on the stall all day, so hopefully I've had the opportunity to speak to many of you today, but we'll be here for a wee while longer. But please do feel free to get in contact. I'm Jennifer Yeomans, and that's our general procurement email address, and somebody can get back to you from there. Thank you very much. We do try, where possible, to encourage the lotting of our contracts. We're also actively trying to engage the next tier suppliers, so absolutely encourage suppliers to bid for our contracts and work, and we'll look to continue to work with our major contractors to engage sole traders, SMEs, supported business as well.
That's great. Okay. One of the other questions that's come through is, are there any additional health and safety requirements needed to deliver for the NHS?
So we, during a contracting process, it's a very important question, and there's also health and safety. There may also be infection protection control elements. There are specific requirements for health and safety or infection control within the health service. That is scoped by, we would always be building our tenders considering what's required during a tender process and with our partners within services across the Health Board to ensure that we're able to put out tenders which meet both the requirements for the health service but also allow wide access for suppliers to tender for.
That's great, thanks Jennifer. One final one then. What level of insurance will I need to bid for your contracts?
It's difficult to say, Gillian. It is all dependent. It's considered at the strategy stage for each tender, so we would look at that individually with each tender and consider that. We do try to have conversations as wide as possible ahead of tenders to ensure that we're not putting anything into that contract that would be prohibitive for supply base.
Okay, and one final one. What opportunities are there for social enterprises?
Absolutely keen to work with social enterprises. Had good conversations today. There absolutely are opportunities. We, again, looking at these with each tender that comes up and considering what market there is in well, the marketplace, and seeing what's available and who is out there to bid for those work, and having as wide as conversations as possible.
Is there any need for medical malpractice insurance?
I probably can't answer that question specifically at the moment. I think I would probably need to take go back and have a look and find out if we've got any specific requirement at the moment. But if you want to grab me at the end and give me your details, I'll certainly be able to take that offline for you. Okay. Thank you very much.